Next guest here as we continue on this February morning is Dr. Kier Huehnergarth, a board-certified cardiologist from the Polyclinic. It's Heart Health Month after all, and hope everybody had a great Valentine's Day, by the way. Dr. Huehnergarth is talking today about the heart in general, and I guess hopefully a question I've always had, Shannon, the difference between cardiac arrest and a heart attack. There is a difference, is it?
There is a difference, and Dr. Huehnergarth is going to explain that. And it's unique because he's a general cardiologist. In today's world, a lot of cardiologists focus on electricity or circulation, but he's general, so he looks at the whole thing.
All right, let's hear about it. To the heart of the matter we go with Dr. Huehnergarth and Shannon O'Kelley.
Dr. Huehnergarth, welcome. How you doing?
I'm doing well, thank you.
That's a crazy last name. How long did it take you to learn to spell that?
I've kind of wondered that, and both of my kids are in elementary school, so I figured they'd be kind of test subjects, and I think by about maybe second grade, they're still working on it a little bit.
Yeah, that's a great name. Tell us about your background. You're a cardiologist, and I know our listeners hear the word cardiologist, but cardiologists actually can specialize in different areas. I mean, you've got the cardiologists that work on the circulation. You got cardiologists that work on the electricity of the heart. What's your focus?
Sure. Yeah, so I'm a general cardiologist, which means I do a little bit of everything, which is really interesting, and there's a lot that we can do for folks. So we range from prevention, which is treating blood pressure, treating cholesterol, investigating symptoms that may or may not be indicative of heart disease, to actually treating honest-to-goodness heart disease, so coronary artery disease, blockage in the heart arteries, valvular heart disease, congestive heart failure, electrical issues. And then there are some nuanced or unique aspects of cardiology. One of my particular interests is sports cardiology, so folks who are athletes, and the majority of those folks are actually regular people, not professional athletes who are just out running marathons, playing indoor soccer, who either have a history of heart disease or have concerns that they may have symptoms of heart disease. And it's investigating that, seeing what their safety of doing their particular sport is, and making it safe for them.
That is an amazing organ. I mean, that thing beats 72 times a minute. How many minutes a day? How many years in your life? I mean, it is a robust organ. Anatomically, if you can, I know we're on the radio, but set the heart functioning up for us.
Sure. Yeah. I think of it kind of as a pathway in my mind when I describe it to folks, and just walking through it as if it's the way the blood flows. So the purpose of the heart really is to move blood around the body, and the real purpose of that is to deliver oxygen, which is the fuel for everything in the body. So once the blood has been through the body and delivered its oxygen and it's returning to the heart, it comes back to the right atrium, which is the right upper chamber of the heart. And then it just travels through the tricuspid valve down to the right ventricle, and it's pumped out to the lungs, and it picks up the oxygen on its way through the lungs, comes back into the left side of the heart, and basically does the same thing. It comes into the left atrium, goes down through the mitral valve into the left ventricle, and it gets pumped out through the aortic valve through the body, drops off the blood, comes back, and does it all again.
And you explained it, and it sounds so simple. But the rhythm and timing and the beats, and that's dependent on electricity. It's dependent on hormones. It's dependent on activity level that we're experiencing, whether or not we're going upstairs or staying still. There's a lot of things going on, and your job is you're this detective. You're trying to figure out who potentially could have problems. If there is a problem, how do you fix it? How did you become interested in that?
Gosh, it's a good question.
Thank you.
It's, through medical school, you get to experience all the different aspects of medicine as you're learning, and you really start developing kind of a gut feeling about what speaks to you and what you feel like you can make a difference in. And in cardiology in particular, you get to develop relationships with your patients. There are folks, if you have heart disease, then that's something that you're going to be going and seeing the doctor for. And that's something that I really enjoy in my practice, is getting to know folks and being with them throughout the course of an illness or improving an illness. And that's the second thing, is that in cardiology, we're very fortunate that we've got very, very good therapies. So most of the different issues, whether it's electrical, whether it's plumbing, whether it's pumping, we've got very good therapies to make things better. And so I like that idea.
All right, that is Dr. Kier Huehnergarth. He and Shannon O'Kelley return right after this timeout on KOMO.
Okay, we were talking about the heart and how it functions. I mean, it needs electricity, it needs volume, it needs a pumping system, et cetera, et cetera. Hey, you know what? Good timing on your part. It is February. It is Heart Month. So, I mean, I want to explain and talk about the difference between a cardiac arrest and a heart attack, because they're two different things, right?
Correct.
So tell us what the difference is. Tell us what's going on in each one of those, and who maybe is susceptible to each one of those.
Yeah, well, it's an interesting topic, and the two get mixed up pretty commonly. So a heart attack is a very specific thing. A heart attack is a blockage of blood flow in one of the heart arteries that leads to death of the heart tissue. And that in contrast with a cardiac arrest. So a cardiac arrest is when the heart stops beating, basically. And there are a couple of different types of cardiac arrest. There's a type where the heart is beating way too rapidly to be able to move blood flow, and that's not sustainable. Usually if that happens, then the heart will subsequently stop beating. And there's a type of cardiac arrest where the heart just stops beating. And so going back to a heart attack and the things that can cause a heart attack, most commonly that's from buildup of plaque in the heart arteries, and then a blood clot can form within the heart arteries and suddenly restrict blood flow. And the risk factors for that are things like high cholesterol, high blood pressure, diabetes, smoking, and a number of others. The risk factors for cardiac arrest, first of all, a heart attack, so a blockage in the blood flow, can lead to a cardiac arrest. But there are other things that can lead to a cardiac arrest, and those tend to be electrical abnormalities within the heart that may or may not have anything to do with the blood flow and coronary artery disease.
So in a nutshell, to summarize, a heart attack is generally related to a blood flow problem.
Correct.
And a cardiac arrest is an electrical problem that could be a result of impaired blood flow or other things going on in the electrical system.
Yes. Yep.
And you talked about having a focus in athletes. And a lot of times we've heard over the years these athletes, these conditioned athletes, all of a sudden have this sudden cardiac arrest, and that's a rhythm problem. Is that right?
It is, and that's the real challenge, is trying to pinpoint folks who are at risk of that and preventing it from happening.
And who is at risk? Because, again, you're looking at these athletic people that are up and down the court or on the football field, soccer field, or whatever.
Those folks, the highest likelihood for cardiac arrest is actually coronary artery disease, because it's so common and they're going out and they're pushing it. And they may have restriction of blood flow in the heart arteries that they just didn't know about.
There you go. Everything you need to know about the heart right there in 10 minutes. That's a 10-minute segment, that's a 4-year residency right there, folks. You got it. Thank you very much for your time.
Yeah, thanks for having me.
All right, once again, that's Dr. Kier Huehnergarth, a board-certified cardiologist from the Polyclinic. Heart Health Month continues, and if you'd like to get more information, you can get in touch with him and find out more about what he does and the rest of the folks at the Polyclinic, polyclinic.com.